Mesothelioma timely detection is imperative. People who are exposed to asbestos dust more often are vulnerable to get the deadly disease, mesothelioma. The disease bring about nasty cells in the epithelium originating in the embryonic mesoderm, the inner membrane that overlies the internal organs of the body. Generally, mesothelioma harms the interior covering of the pectus wall and the lungs. It could also affect the peritoneum, the inner membrane of the stomach, and the serosa that shields the heart and tunica vaginalis. Those employed in asbestos interrelated manufacture companies are the mainly in jeopardy and have showed the largest amount of mesothelioma affected people. Furthermore, families who have a member or individuals working in these sorts of companies are as well affected by the disease, as they often come in contact with asbestos particles when they clean their wearing apparel or from lots of other activities that expose them to asbestos particles. Despite the fact that there will be a high possibility of getting mesothelioma with inhaling smoke from cigarettes, it is not directly connected with smokers. Nonetheless, lung cancers are most striking illness among smokers, whereas mesothelioma assails simply those who have relations with asbestos-associated treatment or by way of their family members. People who live in close proximity to these factories are as well in danger of getting mesothelioma as others. Individuals who have a medical condition with mesothelioma will not reveal signs and symptoms of the illness in its premature stages. This is why it is very hard to detect it at the early phase, and by the time it is detected, it can be by then too overdue to treat them. The indications and symptoms consist of chest pains, weight reduction, and difficulty breathing. Still, they could be different according to the conditions of the patients. CT scan, X-ray and tissue specimen are the analyzing techniques performed on a patient to shed light on if mesothelioma is the issue. The tissue specimens are obtained by inserting a camera with a conduit to the affected regions, and these tissue specimens are directed for microscopic study. Timely sighting of the disease assists medical practitioners to apply effective cures to diminish the effects.